David Crisafulli, Leader of the Opposition, Queensland, 1, 2, 3, 4, 5. Good. Good morning, everyone. Welcome from beautiful Bundy. The Queensland health crisis is real and it's affecting everyday Queenslanders every day. And behind me are a room full of really brave people who are prepared today to come along and tell their story and help drive the change that we are attempting to do, and that is to heal a sick system in Queensland. Now, Ros and I, as Shadow Health spokesperson, Ros and I have done 16 of these across Queensland now. This is the biggest. Over 100 people are here today to help drive the change we need. And there's two things that we want to see come out of these. One is we want individuals to be able to get the surgery they need and the justice they deserve. And the second is we want to drive the change to heal the Queensland health crisis. We have put our solutions on the table. Better resourcing, better triaging, sharing data in real time, and most importantly, putting doctors and nurses back in charge. For over half a decade, we have seen the numbers in Queensland health deteriorate. It's not the fault of the doctors, or the nurses, or the allied health professionals, or those ambos waiting at the end of the ramp. It is the fault of a government that has stopped listening in its third term, that is refusing to empower the doctors and the nurses to take back control of their hospitals. In the case of Bundy, there's another ingredient missing, and that is a hospital befitting of a region this size. Now, before the last election, the people of Bundaberg were promised a level 5 hospital. There was no caveat on that, there was no ifs or buts. Now, the government's been crab walking back and saying that, oh, well, there'll be some services here and they're cherry-picking data. That's not what was promised. This city was promised a level 5 hospital, and we are determined to get it. And we are going to continue to talk about it, and as Stephen has effectively done on the floor of Parliament, we are going to prosecute the need for this region to get it. And in a moment he's going to talk to you about what that means to the constituents he represents, not just in Bundy, but across the greater region. Promises made should be promises kept. And we are determined to get this city the health service it deserves. Now, finally, before I hand over to Ros, I want to make a couple of points locally. In the Bundaberg Hospital, 51% of people who turn up at the emergency, start that again, at the Bundy Hospital, 51% of people who turn up in the ED don't get seen on time. That is the worst in Queensland. 51%. So if you turn up at the ED in Bundy, you have a greater than 1 in 2 chance of not being seen on time. 1 in 4 people sit longer than recommended at the end of an ambo ramp. And again, that's not the fault of the paramedic. They are frustrated. They want to be able to go out and help the next person, but the system is letting them down. And in the last week, again, we've seen the minister looking for a different excuse every day. Canberra or COVID or all sorts of things. Let's cut the nonsense. Ambulance ramping in Queensland is the worst in the nation at 38%. It is worse than anywhere else. So the government can try all it likes to blame others and cherry-picking figures. That's their figures. That's their release of data. And we'd love to see that released in real time. But on the data that Queensland Health presents, ambulance ramping is the worst in the country in Queensland, and we are going to continue to fight until Queenslanders get a world-class health system. Over to you, Ros.
Ros Baird, Shadow Minister for Health and Ambulance Services. Well, Queenslanders deserve a world-class health system no matter where they live. And make no mistake, Queensland Health was in crisis long before COVID. Queensland has the worst ambulance ramping in the country. Let me say that again. Queensland has the worst ambulance ramping in the country at 38%. These are the government's own figures. We know that ambulances across Queensland last week spent 10,000 wasted hours on the ramp. Ambulance ramping only happens when there is no room at the inn. There are no beds to transfer patients to. That means that paramedics cannot offload patients into the ED department and get back out on the road to save you or your family. And why does this matter? Because your life may depend on it. That could be your child having an asthma attack, your father having a heart attack, your grandmother laying on the floor in agony with a broken hip. Queensland Health was in crisis long before COVID. This government cannot be trusted to fix the Queensland health crisis, and this Labor government has no plan to fix the Queensland health crisis.
So today is an important day, and I want to thank Ros and David in particular for coming to Bundaberg, because this is not a new issue for us, unfortunately, locally. And today is a day, and I want to thank the brave people behind us for turning up, because today is about their voices and their stories. And we know David and Ros have the capacity to take these issues to the floor of Parliament, where we can drive real change. I just want to talk briefly about the ambulance ramping issue. For me, in my office, is when I hear the story of a child playing sport in Childers that cannot get an ambulance on time. It's the farmer at Moore Park who's fallen off his bike and has to wait hours for that ambulance to arrive. And it also, as Ros has alerted to, those elderly patients that have fallen down in Bargara that have to wait hours for an ambulance to turn up. So today is an important day for Bundaberg. We've been prosecuting the issues and the failures in Bundaberg Hospital now for many years, particularly since 2019. But I want to thank the people today. I want to thank the team that have turned up here today to make sure that people of Bundaberg finally have their choice and their voice heard. And of course it's an important day. So we look forward to this morning. It's going to be harrowing for a lot of these people, but we want to make sure that they get their voices heard. Thank you.
Thanks for what you've done, Steve.
Wickenden Hospital, it has been on a bypass recently because there are no doctors out at Wickenden Hospital. They've got an aged care home out there that's serviced by that hospital, and with no doctors, and needs no doctors at the aged care home. Is that acceptable for a regional area?
It's not, and as Ros repeatedly says, Queenslanders deserve a world-class health system wherever they live. And part of that involves making sure that allied health is provided. And what my approach would be as Premier is, rather than getting up every day and turning it into a political circus, I'd absolutely work with Canberra to make sure that those things that the nation's capital provide are dealt with. I'd also accept responsibility for the things that Queensland Health is responsible for, like hospitals. And I'm not comfortable that a city the size of Bundaberg and the wider region have a hospital that doesn't have enough beds. And already this morning, as we've spoken to people, we hear stories about them being shuffled around, being told that to claim that a surgery was at a different period of time so that maybe they could get a bed. I spoke with a doctor this morning who told me what it's been like working under this system. They are broken, they are battered, they just want to serve their community, and they're being hamstrung from doing it. People didn't sign up to be a doctor and a nurse to be frustrated and not provide treatment. People didn't sign up to be an AMBO because they want to sit at the end of a ramp. And you know, in Bundy, in the last couple of months of data that's been released, a patient waited here more than 7 hours. Each month, more than 7 hours. Can you imagine being that patient waiting at the end of an ambulance ramp? Can you imagine being the AMBO losing an entire shift because the hospital is overflowing? That is the situation in Bundaberg at the moment. The government made promises and they must keep them.
Do you think the Premier is too distracted by the Olympics to address the healthcare crisis?
Well, the Premier has her priorities, I have mine. The Premier's priority is bird's eye views, rolling out red carpet. Mine is making sure that AMBOs roll out and that we roll out some bitumen to make sure that the Olympics are a generational transformation for every Queenslander. And the more I see of the Premier, the more I see of somebody who has lost touch with the everyday Queenslander. And Queenslanders want the Olympics to be generational in delivering them infrastructure to improve their lives. They don't worry about rolling out the red carpet and sports stars and celebrities. They want the Olympics to be about them and infrastructure for them. And the more I see of the Premier, the more I see it being about sports stars, about red carpet and about how things look for her. Well, I think Steve articulated that brilliantly, that it's not just Bundy, it's the greater region. But they've had enough. And when people are waiting hours for an AMBO to turn up, they know that's not the fault of the ambulance driver. He or she's parked at the end of the ramp, waiting to offload a patient into an overflowing hospital. And I'll tell you what's really getting under their skin is they were promised a level 5 hospital. Now, this was a promise made before the election, and the Premier mightn't operate by the same rule book, but I happen to think that promises made are promises kept. And if you say one thing before an election, you don't walk away from it afterwards. This city deserves a level 5 hospital, and we aren't going to give them 1 inch to move away from that. They made that promise and they're going to honour it. And I don't want it to have to be the case that in 2.5 years' time they've been let down and it's an election issue. But I can assure you if it gets to that, it's going to be very uncomfortable for the government, because that was a promise that was made. We're going to hold them to account on it, and if not, well then I think the people of Bundaberg will make their views known very clearly.
We better get started. We have questions afterwards as well.
We're happy to hang around, guys. Thank you very, very much. Thanks.